Okay, let's unpack this. Welcome to the deep dive. We sift through, well, a lot of sources to pull out those crucial insights, those connections you need to be really well informed. Today, our mission is tackling reproductive health. We're looking at a whole set of materials, conditions, infections, wellness, really aiming to empower you.
Yeah, the goal is a clear path through it all. You get those aha moments, but without, feeling totally swamped.
Exactly. And we're focusing today on excerpts from a medical textbook, digging into conditions affecting maternal newborn health, women's reproductive health. We'll cover the common stuff right through to more serious issues. We really want to help you understand not just what they are, but why they matter, and how to approach them with solid knowledge.
Great. So let's kick off with one many people know or think they know, Candidiasis, a yeast infection. What struck me wasn't just the discomfort, it was how it signals something deeper, like a disruption. What are those maybe less obvious triggers? That's a perfect place to start, because the key thing isn't just the symptom, it's how easily our body's internal balance can get tipped. So candidiasis or moniliasis, yeah, it's the most common type of vaginitis, caused by Candida albicans, a yeast, the main trigger. A change in vaginal pH that lets the fungus just, well, grow much faster, things that promote it. Pregnancy, diabetes, even oral contraceptive use. And interestingly, systemic antibiotics.
The antibiotics.
Yeah, people often forget that. They kill bad bacteria, sure, but they can also wipe out the good ones, leaving space for yeast. Symptoms are pretty classic. Inflammation, burning when you urinate, and that distinct white sort of cottage cheese discharge. And something to note, if someone has recurrent infections and is sexually active, their male partner might get redness and itching on the penis. Balanitis, it's called. Diagnosis is usually confirmed by finding the C. albicans spores. Treatment. There are over-the-counter antifungal creams or suppositories used for like 3 to 7 days, or there's a prescription oral pill, fluconazole. Recurrent infections might need another dose, and they sometimes flag underlying issues like diabetes or maybe even HIV.
So it's really about that internal ecosystem getting thrown off,
Yeah.
in a sense. Now, the sources also touched on vigilance beyond infections. They briefly mentioned things like ovarian cancer symptoms, pelvic pain, increased abdominal girth, abnormal bleeding, different category, obviously, but it's a reminder that any persistent, unusual sign down there needs attention, right?
Yeah.
Part of the whole picture.
Absolutely. It's all connected to overall reproductive well-being.
Okay, so moving from those internal balance issues like candidiasis, let's pivot. Let's talk about infections where external factors, especially human interaction, are key. Sexually transmitted infections, STIs. So what's the big picture here? Transmission, prevention. What do we need to grasp?
Well, the critical thing with many STIs, syphilis, gonorrhea, chlamydia, is how they're primarily spread sexual activity. But it's important, like you said, not all conditions we'll discuss are STIs. Bacterial vaginosis, for instance, isn't typically transmitted that way.
Got it.
STIs are most common in adolescents and young adults. And biological females are actually twice as likely to contract them.
Twice as likely. Why is that?
It's often due to microscopic tears in the vaginal lining during intercourse, making it easier for infections to take hold. But here's the really crucial, maybe the aha part. Many clients are completely asymptomatic, no symptoms at all.
Which means damage can be happening silently.
Exactly. Sometimes irreversible damage, long before anyone even knows there's a problem. That silent progression is a huge challenge. Other factors. Teenagers are more vulnerable biologically. We're seeing antibiotic resistance in some infections. Plus, having one STI can make you more susceptible to others, including HIV. And the fact that people without symptoms often don't get tested or treated, that's probably the biggest hurdle to controlling the spread.
Wow. That really hammers home why awareness and regular testing are so important. It's literally damage limitation and prevention. The sources seemed pretty direct.
Very. Barrier methods, condoms, male and female, give the best protection.
Okay.
But things like diaphragms, cervical caps, spermicides, they just don't offer that same level of STI protection.
And a really key point they stressed. Birth control pills prevent pregnancy, yes, but absolutely not STIs. Cannot say that enough.
Absolute critical distinction, also vital. Treating partners simultaneously. If one person has an STI, the partner needs treatment too. And no intercourse until the cure is confirmed. Prevents just passing it back and forth.
Right. Reinfection. Makes sense.
So the obvious question then is, how do you catch these early, especially if they're silent? Recognizing common signs is key. Unexpected non-bloody discharge, vulvar itching or swelling, pelvic pain, pain during intercourse or urination. Also, abdominal tenderness, skin issues like rashes, ulcers, warts, blisters, even flu-like symptoms.
Flu-like symptoms.
Yeah. Yeah, sometimes the body's initial reaction can feel like the flu. Being aware of any of these subtle signs is often that first vital step towards getting checked out.
Okay, let's unpack the details of some specific STIs then, because they really are quite different. First up, bacterial vaginosis, BV.
Right, so BV isn't technically an STI, remember? It's more of a disruption. The normal, healthy bacteria lactobacilli get outnumbered by others, like Gardnerella vaginalis. We don't know the exact cause, but things like tissue trauma, intercourse, multiple partners, even douching can contribute.
Douching, okay.
Yeah, it disrupts the natural flora. The main symptom is usually a thin, grayish-white discharge with a characteristic fishy odor.
That odor's pretty distinctive, I understand.
It is. Treatment aims to restore that healthy balance, often using metronidazole or clindamycin.
Okay. Next, chlamydia. You mentioned it's common.
Extremely common in Western countries, yeah.
Yeah.
Caused by chlamydia trachomatis. The real challenge here, it's often asymptomatic, especially in biological females. Totally silent.
Which makes it so insidious.
Exactly. And it's not minor. The infection can travel up from the cervix to the fallopian tubes. That can cause pelvic inflammatory disease, PID, which is serious.
Leading to infertility, ectopic pregnancy.
Precisely. Scarring from PID is a major cause of both. Because it often hangs out with gonorrhea, treatment usually hits both at once. Meds like azithromycin or doxycycline are common.
Right, which brings us to gonorrhea.
Caused by Neisseria gonorrhea, again, primarily affects the genitourinary tract, and like chlamydia, it can be asymptomatic in biological females. Or it might cause a pus-like discharge, painful urination, painful intercourse. It's very strongly linked to PID as well, increasing that risk of tubal scarring and all the complications that follow.
So it's really interesting how often those two, chlamydia and gonorrhea, show up together.
It is fascinating, clinically speaking. That co-infection is so common that standard practice is often dual treatment, even if only one tests positive. Just to be safe and prevent those long-term issues, usually drugs like cefixime or ceftriaxone.
Okay, now syphilis, caused by that Spirochete treponema pallidum. Here's where it gets really interesting, potentially quite complex with its stages.
Definitely. If untreated, it progresses. Primary syphilis starts with a chancre that's a painless, firm sore, usually on the genitals, anus, maybe lips or mouth. Highly infectious at this stage.
Painless, though.
Easy to miss.
Very easy to miss or ignore. Then, maybe 2 months later, secondary syphilis hits. Symptoms can be fever, headache, no appetite, and this generalized skin rash, flat spots, raised spots. Sometimes you see moist, wart-like growths too, condyle motulata, usually in the genital area, still infectious.
And if it still isn't treated?
Years later, tertiary syphilis can develop. This is where it gets really dangerous, affecting the heart, blood vessels, the central nervous system. It can lead to severe neurological problems, even paralysis, psychosis. But the good news, penicillin G given as an injection is very effective, especially early on.
Thank goodness for that. Okay, herpes genitalis, caused by the herpes simplex virus, HSV. Usually type 2, but type 1, the one often associated with cold sores, can cause it too. The primary infection often involves blisters, vesicles that break open and form really painful ulcers. Often comes with flu-like symptoms too. Recurrent episodes happen, but they tend to be milder. The key fact, though, there's no cure for the virus itself. It stays in your system.
Right, no cure, but there are treatments.
Yes. Antiviral drugs, acyclovir, valacyclovir, famciclovir, they don't cure it, but they're very good at suppressing symptoms, reducing how often you have outbreaks, and importantly, reducing viral shedding.
Shedding meaning
less
chance of passing it on.
Exactly. Makes transmission less likely. Crucial advice is always avoid sexual contact when lesions are actually present, and always, always inform partners.
Okay. Human papillomavirus, HPV, people know it for warts.
Right, genital warts or condylomata acuminata. They look like dry, wart-like growths, can be tiny or grouped together like a cauliflower.
But the really critical link here is cervical cancer.
Absolutely crucial. Certain HPV strains are strongly linked to cervical cancer. That's why screening is so important. Treatment focuses on removing the warts, freezing, acids, laser, other procedures. But, and this is key, removing warts doesn't get rid of the underlying virus.
So they can come back.
Recurrences are common, yes. Condoms are recommended to help reduce transmission risk.
Got it. And finally, in this specific STI section, HIV and AIDS.
Yeah, connecting this to the bigger picture. HIV leading to AIDS is still globally the most devastating STI. Although it's important to say treatments have improved dramatically. People are living much longer, healthier lives with HIV now.
That's positive progress. Transmission.
Primarily through infected body fluids, blood, semen, vaginal secretions, breast milk. And from mother to child during pregnancy or birth, perinatal transmission. That's why HIV testing is now routine for all pregnant clients, essential for preventing transmission to the baby.
And the source mentioned a shift in risk factors.
Yes, a significant shift. Heterosexual contact is now the primary way HIV is transmitted, surpassing injectable drug use in many places.
Okay, that covers a lot of specific infections. So looking beyond individual treatments, what does this all mean for stopping the more severe knock-on effects?
Well, let's talk pelvic inflammatory disease, PID again. It's an infection of the upper genital tract uterus, fallopian tubes, ovaries. It's actually pretty common over a lifetime, especially in sexually experienced females aged 18 to 44.
And risks are higher for some.
Yes, highest risk is in those who've had STIs before. Also, younger women under 25, their cervices are less mature, offering less protection. And douching, as we mentioned, increases risk too by messing with the natural vaginal bacteria.
And the cause is usually?
Mostly chlamydia and gonorrhea traveling upwards. But other bacteria can be involved too. The result is inflammation, scarring, adhesions, especially in the tubes. That's what leads to infertility, ectopic pregnancies.
Symptoms can vary a lot, you said.
Hugely. From no symptoms at all to severe abdominal pain, fever, high white blood cell count. Treatment typically needs broad-spectrum antibiotics. The key insight. PID is often the end result, the cumulative damage from untreated or repeat STIs. Really underscores why catching those initial infections early is so critical.
Okay. Now, another serious one, though rarer, toxic shock syndrome, TSS.
Right, TSS, rare, but potentially fatal. Caused by toxin-producing strains of Staphylococcus aureus bacteria.
And the toxin does what exactly?
It messes with the capillaries, the tiny blood vessels, makes them leaky. Fluid leaks out of the bloodstream, causing a big drop in blood volume hypovolemia. That leads to low blood pressure, shock, and direct damage to tissues and organs.
What's crucial here seems to be understanding the risk factors, how it can happen.
Absolutely. It's famously linked to using high absorbency tampons, especially if left in too long. Creates a breeding ground for the bacteria. It's also associated with barrier methods like diaphragms or cervical caps if they're left in place for too long.
Okay, and the symptoms are quite dramatic.
Yes. Sudden high fever, usually over 102 Fahrenheit. Flu-like symptoms, headache, sore throat, vomiting, diarrhea, low blood pressure, a characteristic rash that looks like sunburn. And then, interestingly, about 1 to 2 weeks later, the skin often peels from the palms of the hands and soles of the feet.
Wow, so prevention is everything here.
Totally. Proper tampon use. Wash hands before inserting. Change them frequently, like every 4-8 hours. Avoid the superabsorbent types if possible. And for diaphragms or caps, follow instructions carefully. Don't use them during your period, and take them out within the recommended time.
Got it. So we've covered a lot of ground infections, complications. How do we zoom out now and apply all this to promoting overall reproductive health, just long-term well-being?
That's the key transition. How do we take this knowledge and make it practical for everyday health?
Well, the sources talk about nursing considerations, which basically sounds like essential client education, right? Making sure you know the signs, the symptoms, what tests are needed, and crucially, empowering you with info on prevention.
Yeah.
How to avoid exposure, how to promote your health overall, turning knowledge into action.
Exactly. And to illustrate this, the sources had this really powerful case study. It sort of brings it all together. Imagine a client, let's call her Sarah, 36 years old. She's dealing with obesity, wants to get healthier, and her kids are overweight too, so it's a family concern.
Okay.
This is a great example of promoting reproductive health, but holistically. Her risks are obesity, maybe limited finances affecting food choices. The interventions weren't just here's a diet sheet. It was about supporting her desire to change, asking questions so she could articulate her motivation, encouraging her, supporting her through setbacks.
More about behavior change, motivation.
Yes. And figuring out her food preferences to make healthier eating sustainable. Finding practical ways to get more active, maybe involving the kids so it becomes a family habit. It's about building that healthier lifestyle foundation, not just treating one specific thing in isolation.
Right. And while that case focused on weight, it really highlights the bigger principle, doesn't it? That looking after your whole health, diet, activity, managing stress, dealing with underlying issues, it all strengthens your body overall. And a stronger, healthier body naturally supports better reproductive health and ultimately just a better quality of life. It really is all connected.
Beautifully put. That interconnectedness is key.
So we've journeyed through quite a bit today. Common infections like yeast infections, the complexities of STIs like chlamydia, HPV, HIV, serious complications like PID and TSS. We didn't just list them. Hopefully we highlighted how they connect, giving you those insights to be truly well informed.
And I think the constant thread through all of it is the power of information. Knowing the signs, understanding the risks. Early detection makes such a difference. And prevention through smart choices, understanding how things are transmitted, that plays an absolutely vital role in staying healthy.
Definitely. So maybe a final thought to leave you with. Considering how deeply our overall health and our reproductive system are linked,
Yeah.
what's one small, consistent change you could perhaps bring into your daily life starting now to boost your overall well-being? Knowing that, ultimately, it supports your reproductive health too. Something to mull over.